back to our to lipid profile test. You did mention the HDL. Now we left the total cholesterol out, because that's part of the routine test. Should we look at the total cholesterol? And what does it mean anyway? I mean, that's one thing. And also the LDL cholesterol. So what are these? What do they indicate? And should we really worry about them?
Yeah, so this is, a bit of a controversial topic, and it's something that I spend a lot of time, anyone that's following me on social media sees I talk about it a lot, and it's one of the main reasons, one of the main things I work with people in my practice on. Obviously, my background as a heart surgeon gives me a very, unique insight into heart disease. I literally, have my hands in people's chest and operating on them, and I see exactly what heart disease looks like every day. So as you mentioned, when we went through those 5 markers of metabolic health, there are 2 of the 3 measurements that are on a standard cholesterol panel. HDL and triglycerides are in there, but the other one, the LDL cholesterol, is not in there as a marker of metabolic health. And the total cholesterol is just sort of a summation of those 3. So when you actually look at the data around cholesterol, and specifically its relationship to heart disease in particular, but also as a larger issue of what we call in the scientific literature all-cause mortality, but basically how long people live, you see, the relationship isn't as clear as we would be led to understand these days. The central messaging around heart disease is that the most important factor is your LDL cholesterol specifically. And your total cholesterol, was kind of the historic measure before we were better at, kind of breaking down these cholesterol measurements. But when you actually look at the data, the relationship isn't that clear. So for instance, the studies that most show the relationship between LDL cholesterol and heart disease, people that have an elevated LDL cholesterol versus people who don't have an elevated LDL cholesterol, the risk associated with that of developing heart disease is about somewhere between 1.3 and 1.7 times as high, depending on the study you look at. However, when you look at those same studies, those same data sets, and you pick out the people who are metabolically unhealthy, and insulin resistance is one of the common ways to measure this, that risk of heart disease for someone who is insulin resistant versus someone who is not insulin resistant is about 6 times. So 5 times more important, essentially, insulin resistance versus LDL cholesterol levels.
So we should worry more about insulin resistance.
Exactly.
And why don't we measure it? Why is it not routinely measured?
Well, again, I think that comes down to the fact that we have medications that lower LDL cholesterol. So it's very easy to set, broad guidelines and apply them to populations and say, if someone has an elevated LDL cholesterol, you give them this medication, you bring down the LDL cholesterol, and maybe that does lower their risk of heart disease a little bit, but it's nowhere near the magnitude that people perceive it to be. And so, the benefits of these medications are overstated. And then, to be honest, the negative effects of being on these medications, especially over the long term, because remember, we're now talking about 30-year-olds, even 20-year-olds that I see started on statins, and so they're going to be on those medications for 40 and 50 years. And the reality is that we know very little about those long-term effects. So we don't know, what happens to people who are on them for 40 or 50 years. There are some concerning signals within that data. So I don't tell people, you should never take a statin. I don't tell people that statins have no use in the, prevention of heart disease. I just, go through the data, and this is what most physicians don't do because they don't know the data to this detail. But when you really go through that data and you talk about the risks and benefits of these things, you end up, like you said, why don't we just focus on insulin resistance and metabolic health? And oh, by the way, most people that improve their metabolic health don't end up raising their LDL cholesterol. Some do, and that gets, talked about a lot. And, I know a lot of people in your audience will have had the experience where they go on a keto diet or a low carb diet and all their numbers get better. Their blood sugar comes down, their hemoglobin A1C gets better, their HDL goes up, their triglycerides come down, they're less insulin resistant if they have a doctor that looks at that. All those things happen, but their LDL cholesterol goes up a little bit. And the physician immediately says, "Oh, this is a dangerous diet. It's killing you. You got to get off it."
That's what happened.
And again, it just makes no sense because you look at the totality of the evidence, and insulin resistance and poor metabolic health is so much more of an important factor when it comes to the prevention of heart disease. That is what I tell people they should be most focused on. And we can talk about LDL cholesterol, and it might play a little role, but in the end, it is not the causative factor of heart disease that we are led to believe.